Hi, I'm doing the intradermal injection video. So the first thing I would want to do is I would want to verify the provider orders against the MAR, and I would want to compare the medication, which is Turbasol, against the provider order and the MAR for my first two checks. And I would see that I am going to be giving 0.1 milliliters of the medication. So I would know that I had the correct patient, the correct medication, the correct route, the correct dose, the correct time, and the correct documentation. So my six rights have been checked off. And so then I would gather all my supplies and I'd go to my patient's room. Hello, my name is Tiffany. I'm going to be your nurse today. I would provide privacy. I would verify the patient's first and last name and date of birth against their wristband, and then I would go over to my computer, and I would ask them, do you have any allergies to medications that I need to be aware of? This includes medication allergies, seasonal allergies, food allergies, or hypersensitivities. And if they said no, that's great. I would verify that against the MAR. And then I would do my third check with my medication, which is Tubersol, and I'm going to be giving 0.1 milliliters. I would let the patient know. So what I'm going to be doing today is a tuberculosis skin test. Basically, it's just a tiny little prick that goes into the epidermal layer of your skin, about 3 millimeters, and I just inject 0.1 milliliters of the solution under there, and you might feel a little bit of burning or stinging when I do that, but it should resolve fairly quickly. Some side effects that I do want to make you aware of is you might have a little bit of pain or discomfort, maybe a little bit of itching, but side or adverse effects that you want to report right away would be if you were feeling like you had an allergic reaction with shortness of breath, tightness of chest, difficulty breathing, or like a lot of itching. That we would want to definitely let the provider know right away. So do you have any questions for me before we begin? And if they don't have any questions, then I will go ahead and perform my hand hygiene. And I will put on my gloves. I would start by getting my alcohol wipe, and I would find the patient's arm. It's either 3 to 4 fingers from the antecubital area or a hand's width from the wrist, because you want to do it right here on the upper forearm. And if there's not a spot on the upper forearm, you could do it on the upper back. But I would want to inspect their skin, make sure there's no bruising, there's no lesions, palpate for sensitivity, and if they said that everything was fine, then I would go ahead and I would get my alcohol swab, and I would start where I'm going to give the injection, and I would circle out 2 inches, letting it just sit and dry on its own. I wouldn't blow it or wave at it. And so then I would have my tuberculin syringe, which this syringe is a 1 milliliter syringe, a 25 gauge, and it is a 5/8 inch needle that I'm going to be using. So I would get my syringe, I would get another alcohol wipe, and I would clean the top of the medication. Make sure we can see this here. And I would uncap this, and I would draw up 0.1 milliliters of air. And I'm not sure if you guys want to see this part too. I just to make sure that I have my measurements right. 0.1, it's right there, right on that line. Okay, so then I would want to put it into the medication, making sure that the needle does not touch the medication when I inject the air. So I would inject that into the vial, and then I would flip it over, and I would pull out 0.1 mils of the medication, making sure not to overdraw. So I would take that out. And then I want to check for any air bubbles, but I'll let you see here that I did, sorry if it's hard to see, but I did draw the 0.1 and it's right to that line. So then I would check for any air bubbles to get those out. Okay, and then bevel up. I would hold the patient's skin with my forefinger and my thumb, and I would hold this with my syringe with my thumb and forefinger, and I would come in at a 5 to 15 degree angle, and I would meet a little bit of resistance, and I would go 3 millimeters into that epidermal space, and I can see the bulge from my syringe there. So then I am going to go ahead and slowly inject medication. Need that resistance. So then I want to get my gauze pad, lightly place it over, pull the needle out, and we would just pop that safety lock up and dispose of this in the sharps container. And then I would inform my patient. I wouldn't not to rub or put any friction or pressure onto the site. And if it looks okay, I wouldn't put a band-aid on it. And if it had maybe like a tiny little bit of blood, then I would just very lightly put a band-aid over it so it doesn't create any pressure. So with that, I would remove my gloves and I would perform hand hygiene, and I would let my patient know that they will have to come back in 48 to 72 hours to have that area reassessed. And that's it.